This presentation on using simulation pedagogy to teach clinical education skills, a randomized trial, by Claire Holdsworth, Elizabeth Skinner, and Claire Delaney, is a study that will be presented by Michael Tichy. This study was conducted in Australia and was a comparison between typical clinical education courses that focused more on passive learning, such as lectures, and a comparison between simulated learning environments, which encouraged more active participation. Local educators rarely have the opportunity to reflect on the teaching skills in real-life scenarios and receive feedback for their performance. Most education provided for clinical instructors is done in a more passive learning model, utilizing lectures or online material to provide information. For the study that is noted, simulated learning environments were utilized in which participants completed 2 3-hour workshops that included clinical teaching scenarios, facilitated debriefing after the interventions, and the discussion of the student-teacher interactions while interacting with their students and also other peers. The primary objective of this study was to test the effect of simulated learning environments on educators' self-efficacy and student supervision skills versus the standard online instruction that is typically utilized. The secondary objective was to measure student ratings of educators and their supervision skills who participated in the simulated learning environment program as compared to the standard educational methods, utilizing online lectures as a methodology for teaching and learning in clinical education. This study was a pilot prospective randomized controlled trial that was published in 2016. It was actually conducted from January to October of 2013 utilizing clinicians who were physiotherapists in Australia with varied degrees of experience. A convenient sample of 20 educators were chosen and randomly assigned to the simulated learning environment group or the standard education group. Of the 20 participants in the study, a total of 18 participants actually participated in the study to completion. This was divided by the simulated learning environments, which had 10 participants, and the standard education group, which had 8 participants. Both groups completed their intervention components during a 4-week period from April to May 2013. In addition, both groups of educators supervised students in the clinic up until October of 2013. During the study, the simulated learning environment group received 6 hours of total instruction over the course of 2 to 3 weeks, working in small groups of 5. The main learning objectives of the simulation workshops were to build awareness of and distinguish between different supervision approaches and to practice using different pedagogical strategies to develop insight into their own supervision approaches and learning needs as a supervisor. They also discussed student learning needs and pedagogical approaches when working with students and discussed student supervision in what would be considered a safe environment away from the demands of clinic work that requires direct patient care. The standard education group consisted of clinical educator training that was typically utilized for physiotherapy conditions. These clinicians completed 2 online learning modules chosen to cover similar education topics to the simulated learning environment group. Variables selected for measurement during the study included educators' self-efficacy and student ratings of the instructor's supervision skills. Outcomes were measured at 4 time points to include baseline, pre-intervention, post-intervention, and 4 months after baseline of the final clinical practice for the students that year. Self-efficacy was measured using a purpose-designed questionnaire which measured 8 key domains of supervision. Student ratings of educators' supervision skills were measured using the Clinical Teaching Effectiveness Instrument, which is a reliable and valid instrument developed to evaluate the quality of clinical teaching of educators. Statistical analysis were performed on the data, and a p-value of less than 0.05 was accepted as statistically significant. The results suggest that the simulated learning environment educators who participated in teaching skills in real time and then participated in debriefing sessions to reflect on the interventions were effective in increasing their self-efficacy in utilizing different teaching styles for the students' benefit. Self-efficacy scores for the standard education online module group did not change significantly over time in the majority of the assessment criteria, even though these participants completed 2 online courses and supervised a similar number of students in the same hospital as the simulated learning environment group did. This study was the first randomized controlled trial to look at the effects of simulation training compared to online learning educational models to teach student supervision skills to physiotherapist clinical educators. This study, while being performed in Australia, did not have the benefit of the APTA's Credentialed Clinical Instructor Training course, which utilizes a similar format to the simulated learning environment class noted in this study. As evident by the results and details of this study, an interactive learning environment in which clinicians can experiment and discuss various pedagogical strategies to enhance students' education is paramount to learning. This is of particular importance for all clinical instructors here in the United States. In order to advocate for participating in the APTA's Credentialed Clinical Instructor course so that the clinical instructors may reap the same benefits as the clinicians who participated in the simulated learning environment group noted in this study.